Dr. Malcolm Sayer is a modest and immersed in his research who works at a hospital in the Bronx. He avoids socializing and feels awkward in social settings, but his sincere desire to help patients is evident from the first frames. Malcolm takes a job in a unit for chronic patients, most of whom are in a coma-like state. These patients do not speak, do not respond to external stimuli, but remain alive. He immediately notices a patient named Leonard Lowe, a middle-aged man who has not come out of this state for many years. Leonard becomes special to the doctor, as he senses that there is a hidden personality inside him that is trying to get out. Malcolm begins to study the patient's histories and realizes that they all once suffered from encephalitis, which led to their current condition. He notices small signs of life in some of the patients, such as the ability to follow objects with their eyes or minimal finger movement. These observations lead him to think that perhaps their condition is not irreversible. The doctor begins experiments in an attempt to awaken them. One of the first scenes illustrating this process is when Malcolm notices that the patients respond to certain stimuli. For example, he throws a ball in front of one of the patients and the patient catches it unexpectedly, although he immediately returns to a motionless state afterwards. These small manifestations of activity inspire the doctor to continue his search. Malcolm learns of a new experimental drug that has been successfully used to treat other neurological disorders. He convinces the hospital authorities to allow him to conduct an experiment using this drug on Leonard, whom he chooses as his first patient. This choice is motivated by the fact that Leonard, despite his condition, is the most active compared to the others. At this point, Malcolm shows incredible determination despite the skepticism of his colleagues. After the first injection of the drug, there are no visible changes, and the doctor loses hope. A few days later, however, a miracle occurs. Leonard regains consciousness. His awakening is shown as a quiet but touching moment. He first looks around, not realizing where he is, and then begins to speak, surprised that his voice sounds different from what he remembers. For Leonard, it's as if it's only been one night since he lost consciousness, but he gradually realizes that many years have passed. Malcolm talks to him, explains what happened, and sees Leonard slowly coming back to life. He is experiencing a storm of emotions, ranging from joy to anxiety about his future. Malcolm continues to administer the drug to other patients, and soon the ward comes alive. People who have been immobile for years start moving, talking, laughing. It's an incredible moment for everyone who's worked with them. Relatives of patients come to the hospital to see the miracle with their own eyes. One of the most touching scenes is when one of the patients meets her adult son, whom she last saw as a child. Emotions overwhelm all participants in this process. However, special attention is paid to Leonard, as he becomes the central figure of the story. He is trying to adapt to a new world that has changed during the years he has spent in isolation. He begins to write in his diary, telling his thoughts and feelings. He remembers how much he missed life, simple pleasures like going for walks or reading a book. Leonard asks Malcolm to allow him to leave the hospital for at least one day to feel free. This request causes controversy among the doctors, but Malcolm, realizing the importance of this request, convinces the management. Leonard goes outside, and it becomes an unforgettable moment for him. He feels the wind on his skin for the first time in years. He hears the sounds of the city and sees people living their lives. He meets a girl named Paula, who works in a cafe near the hospital. A friendship develops between them and then deeper feelings. These scenes show how Leonard learns to love life again and appreciate every moment of it. However, the joy does not last long. Gradually, the patients begin to return to their former state. The drug loses its effectiveness, and none of the doctors can explain why this happens. Leonard is the first to notice his symptoms. His hands begin to tremble, and he finds it increasingly difficult to speak. He records this in his journal, trying to preserve as many waking memories as possible. In one scene, he talks to Malcolm, confessing that he is afraid of losing himself again. Leonard decides to use the time he has left to make a mark on the lives of others. He reaches out to the patients who are still conscious and convinces them to appreciate every moment. He also asks Malcolm not to stop in his research despite his temporary lack of success. Soon Leonard is fully back to a still state, leaving behind a deep impression on everyone who knew him. Malcolm stands in front of the ward, observing the patients who have once again immersed themselves in their worlds. He feels both the bitterness of defeat and the inspiration that even a brief period of awakening has brought so much joy and meaning to their lives. Malcolm realizes that his work has not been in vain, and that every minute of meaningful life is precious.